Today's topic is Diphyllobothrium latum. Everybody say Diphyllobothrium. It is called fish tapeworm. It is called fish tapeworm. So it belongs to cystodes. Now all the unicellular parasites are called protozoans. You know now, unicellular are called Unicellular are called protozoans. Unicellular are called everybody. Unicellular parasites are called protozoans. Unicellular protozoans are called protozoans. Unicellular protozoans are called protozoans. So important parasitic infections that are produced by are amoebic dysentery. Amoebic Amoebic dysentery is caused by which organism? Entamoeba histolytica. Very good. Entamoeba histolytica. How man get infected? Entamoeba histolytica. How man get infected? No. How man get infected? No. How food and water containing what? Food and water containing what? Infective form important, you should know. What is the infective form? Entamoeba histolytica. It is quaternucleate cyst. It occurs in two forms. One is trophozoite. Infective form is cyst. Infective form is cyst. Where it go and gets inhabits quaternucleate this Entamoeba histolytica. Not liver. Liver is extraintestinal manifestation. In the human body, habitat of this parasite is descending colon. This is ascending colon, this is transverse colon, this is descending colon, especially sigmoid colon. Okay, it gives rise to blast-shaped ulcer in the intestine. Blast-shaped ulcers in the intestine. It gives rise to amoebic dysentery. It gives rise to this is passing of stool with blood and mucus. Passing of the stool with blood. Through the portal vein, these enter the liver. They can go to the lungs. And they can go to the brain also. These are called extraintestinal intestines of amoebiasis. These are called extraintestinal. Now, laboratory diagnosis is examination of stool. You make two preparation. One you put iodine, and then you put saline. Emulsify stool in and put the stain. And one in iodine is good for demonstration of cyst. Saline is trophozoite. Saline for trophozoite. Saline for trophozoite. Treatment is metronidazole. metronidazole or tinidazole. Metronidazole or tinidazole. Metronidazole or tinidazole. Treatment is metronidazole or tinidazole. Metronidazole and tinidazole. Now moving to the next parasite. There is a test. Moving to the next parasite, that is G.lamblia. Next parasite is G.lamblia. So it also occurs in the form of cyst and badminton shaped trophozoite. How man get infected? G.lamblia getting fecal-oral route by ingestion of cyst in food and water. Ingestion of cyst in food and water. Ingestion of cyst in food and water. Habitat of this parasite, where it goes and stays in the human body. Remember, with duodenum and jejunum. It present in the duodenum and jejunum. And it gives rise to giardiasis. Especially, it gives rise to fat malabsorption. It gives rise to fat malabsorption. It gives rise to fat malabsorption. Again, laboratory diagnosis is done by iodine and saline. Iodine for the cyst, saline for the trophozoite. Saline for the trophozoite. Okay. Next one is Trichomonas Virginalis. Everybody say Trichomonas Virginalis. Everybody say Trichomonas Virginalis. Trichomonas Virginalis. Trichomonas. It is a sexually transmitted parasitic infection. Sexually transmitted parasitic infection. Route of infection STD. It is sexually transmitted disease. It causes vaginitis. vaginitis in female, and urethritis in male. Lab diagnosis, it causes urethritis in male, vaginitis in female. Lab diagnosis, we have to examine the vaginal and urethral we have to examine the vaginal and urethral discharge. We have to examine the vaginal and urethral discharge. We have to examine the vaginal and urethral discharge and look for the trophozoite in saline preparation. Please remember, no cystic stage, no cystic stage in Trichomonas Virginalis. There is no cystic stage in Trichomonas Virginalis. There is no cystic stage in Trichomonas Virginalis. There is no cystic stage in Trichomonas Virginalis. Next, we move on to the Trypanosoma Bruciae. Typinosoma Bruciae. Typinosoma Bruciae. What it gives rise to? Typinosoma Bruciae. It gives rise to sleeping sickness. Man get infected by the bite of tsetse fly. Man get infected by the bite of tsetse fly, and it gives rise to sleeping sickness. Okay, it's not very common in India. It's common in South Africa. It is common in South Africa. It is common in South Africa. So you just remember these points. That's enough for you, because you'll not come across this thing in your um, Trichomonas cruzi causes Chagas disease. Trichomonas cruzi causes Chagas disease, and man get infected by the bite of rootwit bug. Man get infected by the bite of rootwit bug. Man get infected by the bite of rootwit bug. It gives rise to megacolon. What is colon? Everything is enlarged. Megacolon, megaesophagus. So remember about this Trichomonas cruzi, Chagas disease, rootwit bug, uses megacolon, megaesophagus, and everything is big. So moving on to next is last time I told you the parasite which causes malaria. Okay. So malaria, you remember with mal. Mal means bad. Bad air that gives rise to malaria. Okay, malaria. So there are important is four species: Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malaria. So you remember Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malaria. Everybody. Plasmodium vivax, falciparum, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malaria. Vivax, falciparum, ovale, malaria. Vivax, falciparum, ovale, and malaria. Okay, one more has been added, Plasmodium novalis. So these are the parasites which infect the man. Man get infected by the bite of female Anopheles Man get infected by the bite of female Anopheles mosquito. Man get infected by the bite of female Anopheles mosquito. Man get infected by the bite of female Anopheles mosquito. Don't see that. Don't write that. We'll give in the form of PDF. Don't worry. And this lecture will be uploaded in the YouTube. You have to go through the lectures. Female Anopheles mosquito. Why female? Why not male? Because female needs human blood. Female needs human blood for laying eggs. Female needs human blood. Female needs human blood for laying eggs. Female needs human blood for laying eggs. So coming to the life cycle of malarial parasite. So everybody had to repeat with me. I told last time also. Last time it was a little complicated because we followed some lengthy this thing. I'll make it very simple life cycle. So repeat with me whatever I say. Life cycle occurs between man and mosquito. Life cycle occurs between man and female Anopheles mosquito. Man and female. Everybody repeat. Man. Life cycle occurs between man and female Anopheles mosquito. Man is intermediate host and mosquitoes are definitive host. Man is intermediate host and female Anopheles mosquito is a definitive host. What is the difference between the definitive host and intermediate host? Ramdas, no, your name? Tell me. Gangadhar. What is the difference between sit down? No, the difference is in man, asexual stage. Asexual or larval stage. That is asexual stage of the parasite. Here it is sexual stage. Okay, sexual stage of the parasite development takes place. Okay, so here it's breaking of the parasite. It is called schizogony. Schizogony. It is here. It is syngamy. Here it is syngal. Here it is breaking here schizogony. There it is a syngal. Schizogony and syngal. Okay. Man get infected by the bite of female Anopheles mosquito, and infective forms are sporozoites. Infective forms are everybody. Infective forms are sporozoites. Infective forms are sporozoites. Man get infected by the bite of female Anopheles mosquito, and everybody. Man get infected by the bite of female Anopheles mosquito, and sporozoites are infective form. There are two habitats. The first one is in the liver. The second one is RBC. There are two places where parasite live. First one is liver. Second one is RBCs. So they go to the hepatocytes, liver, and they multiply here. They multiply in the, and it is about 9 to 14 days. This is also called as pre-erythrocytic cycle. That is called as pre-erythrocytic. It is called as pre-erythrocytic cycle. It is called as pre-erythrocytic cycle. It is also called as pre-erythrocytic cycle. It's called as pre-erythrocytic. After 19 14 days, some 12 to 15,000 merozoites are liberated, and they go to the RBCs. They go to RBC. Merozoites are liberated, and they go to RBCs. So RBCs, you see, there are three forms: early stage, early ring stage, then trophozoites, then schizons. Then they break and give rise to gametocytes, microgametocytes and macrogametocytes. This is macro. Female are big and males are microgametocytes and microgametocytes, and some of the schizons can transform into trophozoites. Again, they may, except in falciparum, they go back and attack the liver and stay in the form of hypnozoites. And these trophozoites may attack new RBCs. And these male and female gametocytes are sucked up by mosquito during their meal. The female and male gametocytes are sucked up by the female mosquito during the blood meal. They are sucked up by the mosquito during the female and male unite to form zygote, ookinete, and oocyst. In the stomach, an oocyst comes out and they burst. Release of sporozoids. Release of sporozoids. And these sporozoids are injected, and this takes about 9 to 13 days. This is called as external incubation. This is called as external incubation period. So this is the life cycle of malarial parasite, and there is relapse are very common in case of malaria oval and vivax. There is no relapse in case of falciparum. But falciparum is very dangerous because it gives rise to, because Schizogonis takes place in the brain, giving rise to cerebral malaria, and Schizogonis take place in the renal vessels, giving rise to black water fever. Cerebral malaria and black water fever. Cerebral malaria and black water fever. Laboratories of malarial parasite. Get some Shanmugam in the hospital, get some malarial parasite and show them. Okay. So we have to do the pick and smear, do the Leishman stain. How we do it for WBCs? We have to do thick and thin smear. Thick and thin smear, and thick smear is for the identification of the parasite, and thin smear is for the identification of the species, that is vivax, oval, falciparum or malaria. Vivax, oval or falciparum or malaria. So this is about, in nutshell, the lab diagnosis of malarial parasite, how we do, and what are the 4 species. And the other one, novalis, has been added. That's very important. Then moving on to the one more parasite. Everybody say Leishmania donovani. Leishmania donovani. Leishmania donovani. Leishmania donovani. These are the people who discovered this, Leishman and Donovan. So they are named after this. They got the name for the discovery of this parasite. Leishmania donovani. Leishmania donovani. It occurs in 2 forms: a mastigote form and promastigote form. It occurs in a mastigote form and promastigote form. A mastigote form means no flagellum. This one flagellum is there. The mastigote form. This is a mastigote form. This is promastigote. A mastigote form. This is promastigote. A mastigote form and promastigote. These are the 2 forms what you see in case of Leishmania donovani. It causes infection called Kala-Azar. It gives rise to infestation called Kala-Azar. Kala azar. Kala azar. Infection called as Kala azar. Infection called Kala azar. So moving on to the life cycle of Leishmania donovani. The life cycle occurs between man. Man is the definitive host. Vector, we call it as vector. Vector is sandfly. Vector is sandfly. Vector is sandfly. Phlebotomus argentifus. The zoological name is Phlebotomus. Phlebotomus argentifus. Vector is Phlebotomus argentifus. Man get infected by the bite of sandfly. Man get infected by the bite of sandfly. Man get infected by the bite of sandfly. And the infective form is promastoid. Infective form is promastoid form. So habitat of this parasite is present in the reticuloendothelial system. Habitat of this parasite is present in the reticuloendothelial system. Habitat of this parasite is present in the reticuloendothelial system. The reticuloendothelial system, it gives rise to hepatosplenomegaly. And skin becomes black, wrinkled. That's why it's called as kala azar. And lab diagnosis is done by demonstration of a mastigote in, they are called LD bodies, Leishman-Donovan bodies in macrophages and monocytes, called demonstration of LD bodies in the LD bodies. So now you know how many parasites name. The first one remembered was Entamoeba. It gives rise to amoebic dysentery. Entamoeba histolytica. Man gives rise to. Route of transmission is feco. FO means feco oral route. Feco oral route. Okay. Infective form is sporozoid. Cyst, quaternucleate cyst. The second is Giardia lamblia. It gives rise to giardiasis. Again, it is feco-oral route. Infective form is cyst. Okay. The third one is Trichomonas Virginalis. It gives rise to vaginitis. It is STD. It is sexually transmitted disease. The fourth one is Trichomonas Bruciae. It gives rise to sleeping sickness. Bite of Tsetse fly. Bite of tsetse fly. Tsetse fly. Then fifth is Typinosoma Bruciae. Gives rise to Chagas disease. It is bite of rootweed bug. Bite of rootweed bug. Next is Leishmania L.donovani. Gives rise to Kalaza. Again, bite of sandfly. Okay, bite of the sandfly. Seven, malaria. So you have to remember Plasmodium 5. Okay, Vivax, OL, falciparum, falciparum, malaria, no lacing. So it's malaria, bite of female Anopheles, female Anopheles mosquito, female Anopheles mosquito. So we can add some more protozoan. Next is 8 Valentinium coli. It gives rise to, it's like amoebic dysentery. It's pigs coli. It's a pig's parasite. Man get infected. It is called Valential dysentery. Man get fecal root, just like amoebic dysentery, Valential dysentery. Then ninth, Toxoplasma gondii. Toxoplasma gondii. Man get infected by, and again it is fecal root oocyst present in the feces of the cat. Feces of cat. Man get infected by the bite of feces of the cat. The next one is free-living amoeba. They are present in the water. 10th one, no? 10. What is the number? We have not written. Okay. 10th one. Free-living amoeba. Neglaria acanthamoeba. Neglaria acanthamoeba. Neglaria acanthamoeba. Man get infected by root of inhalation. And they give rise to primary meningo encephalitis. Primary meningoencephalitis. They give rise to primary meningoencephalitis. 11. There are opportunistic parasitic parasitic infections. Opportunistic parasitic infection. Pneumocystis carinii. Pneumocystis carinii can give rise to what is called as pneumonia in AIDS patient. Pneumocystis carinii gives rise to pneumonia, and Cryptosporidium parva. Cryptosporidium AB, put it as AB. Cryptosporidium parva gives rise to diarrhea in AIDS patient. So you have to remember all these 12, 13 parasites in the, at least name you should remember, and it's very important. It's because they are asked in your examination. So next, moving on to the helminths. Helminths are multicellular parasites. Helminths are multicellular parasites. Helminths are multicellular parasite. Helminths are multicellular parasite. They are classified into three. One is cystodes, nematodes, and roundworms. These are called nematodes. Everybody repeat with me. Cystodes, nematodes, and nematodes. So these are tape-like worms. Cystodes are tapeworms. Nematodes are leaf-like, and these are roundworms. These are roundworms. So cystodes, first one is beef tapeworm. Beef tapeworm is Tinea saginata. Beef tapeworm is Tinea saginata. Beef tape, everybody, beef tapeworm is Tinea saginata. Beef tapeworm is Tinea saginata. Beef tapeworm is Tinea saginata. Next is pork tapeworm. Pork tapeworm is Tinea solium. Pork tapeworm is Tinea solium. So man get infected by eating uncooked or partially cooked meat, meat of pork or beef, uncooked or partially cooked meat or pork. They are in the intestine. Habitat is in the intestine. The third one is dog tapeworm. Dog tapeworm is called Echinococcus granulosus. Echinococcus granulosus. It is fecal-oral route. Eggs present in the feces of the dog. Feces of the dog. Egg present in the feces of the dog. Okay, and it gives rise to hydrated cyst. It gives rise to hydrated cyst in the liver. Then fourth one is dwarf tapeworm. Dwarf tapeworm. It is called Hemelepis diminuta. Dwarf tapeworm. Then Hemelepis nana. That is rat tapeworm. Rat tapeworm is Hemelepis nana. Now last one is fish tapeworm. That is Diphyllobothrium latum. That's what we are going to study today. Diphyllobothrium latum. So this is what tapeworms and roundworms. Nematodes are roundworms, whereas flatworms, tapeworms are okay. So you have adult larvae and eggs. Cystodes are segmented, and there are two types of cystodes, tissue cystodes and nematode. Diphyllobothrium, hold like this, everybody, hold. Diphyllobothrium latum. It is called double-headed. That's why it is called a Diphyllobothrium latum. Double-headed tapeworm, Diphyllobothrium. It is the largest parasite in the human intestine. The largest intestine in the human parasite. This is all you won't remember because it was discovered by Bonnet and Janicki. Habitat is small intestine, especially in the ileum. Habitat, small intestine, especially in the ileum. Small intestine in the ileum. So longest tapeworm life cycle. It has got three hosts: man, cyclops, and fish. Everybody, repeat with me. It has got three hosts: man, cyclops, and fish. And man get infected. In infective form is pleurosarcoid. Infective form is pleurosarcoid. In the fish, man get infected by the by the ingestion of. Hello? Yeah, tell me. ನಾಳೆ ಬೆಳಗ್ಗೆ ಬರಬೇಕಾಗುತ್ತೆ 2 to 5. ಇವತ್ತಿಲ್ಲ ಇವತ್ತು ಸಾಯಂಕಾಲ ಇರಲ್ಲ. ಸ್ಯಾಟರ್ಡೆ ಸಂಡೇ ಮಾತ್ರ ಸಾಯಂಕಾಲ. ನಾಳೆ 2:30 to 5:30, 6 o'clock ವರೆಗೂ. ಹೌದು. ಓಕೆ, ಕರ್ಕೊಂಬನ್ನಿ ನಾಳೆ. ಓಕೆ, ಯಾ. So, fish tapeworm is Diphyllobothrium latum. Fish tapeworm, remember it as Diphyllobothrium latum. So, this is the three forms: adult form, operculated eggs. Eggs are Corasidium, fluorosorcoid, and secondary adult form containing megaproglottids, colex. Colex thematic with two bothria. It's in ivory color. It's about 10 meters long. Very large parasite. Head is colex in the spoon shaped, and bothria, sucking grooves, one dorsal and one ventral. No suckers, no hooks. It has got these segments, body segmented. No, it has 3,000 to 4,000 segments, and testis, numerous minutes, testis dorsally and laterally. Female bilobed, rosette like uterus, midline. So this is the diagram of this thing. So you need not have to elaborately know the diagram of this parasite. Just you remember its egg layer. Millions of egg per single day. Egg is about 65 to 45. Brown shell, operculum, small knob. Freshly passed egg, immediate embryo comes out, resistant to chemicals like drying. Oncosphere, 6 hooklets inside the egg. This is the egg life cycle. This is a life cycle. So man get infected by eating fish. Man get infected by eating fish. In man, eggs are released and develop into Corasidium, pleurosarcoid. They infect the fish, and fish L1 larvae. Then man get again infected with the fish. So first they develop in cyclops, then fish. So this is the life cycle and CDC. It gives rise to malabsorption of B12 and leads to megaloblastic anemia. Gives rise to megaloblastic anemia. Most are asymptomatic, minor intoxication equal to abdominal pain, diarrhea, vomiting. It gives rise to megaloblastic anemia, Diphyllobothrium latum. Remember that. Stool examination, you see examination and Karamin stained gravid prokaryotes. You can do RT-PCR, it shows RT-PCR. Blood shows megaloblastic anemia, and treatment is praziquintal, niclosamide, and preventive measure. Jewish housewives disease because they acquire infection by tasting uncooked fish while preparing. Okay. Proper cooking of fish is necessary, deep freezing. Thank you. This is about Diphyllobacteria. Later, we'll continue in the next class. What we do is we can start answering your question papers. That's a better way of teaching you. That's ideal way, so that we can cover many topics in single. Anyway, we'll complete this parasitology. Virology has been completed. No worries. Virology. Virology. Okay. Thank you very much.